Ladies and gentlemen, welcome back to the YouTube channel Doctor's Wisdom Share. The topic we would like to share with you today is sudden death among young people. Dear viewers, in recent years, from time to time, when we read domestic news or international news, we often come across reports that many of you have probably read as well. These are reports about young men and women born in the 1990s who died suddenly. They may have been drivers, delivery workers, surgeons, or even directors of companies. And whenever this topic is discussed, I immediately think of a close friend of mine who also died suddenly. It is truly painful to recall and speak about this. Ladies and gentlemen, many people are forced to work overtime, to work extremely hard, just to make ends meet because of pressure. Some of them are even afraid to go for medical checkups. And I think that the physical condition of these people is very much like a lottery ticket always kept inside the chest pocket, and the unexpected moment may come to them at any time. However, when they finally open that lottery ticket through their daily habits, the result they receive may very likely be negative, that is, sudden death. I want to tell you, ladies and gentlemen, that daily living habits cannot be trained in just one day. Health cannot suddenly become strong in one day, and likewise, we cannot suddenly become weak within a single day either, because health is a long process. So why did we name today's topic sudden death related to young people? As age increases, the risk of sudden death naturally increases. But when this issue occurs among young people, it causes even greater pain and sorrow. Today's program will be divided into three main sections. The first section will discuss the direct causes of sudden death. The second section will discuss the indirect causes leading to sudden death, and why these causes are closely related to overwork. The third section will discuss the signs of overwork, and how to correct this condition. As for myself, I am a physician who examines and treats patients on a daily basis. And just like any other doctor, we encounter many cases of young people who die suddenly. But when such cases involve people we know personally, friends, relatives, or acquaintances, they become truly tragic stories. I have a friend who was very successful. His life was overflowing with work, completely full of work. He was a leader in an organization, and it must be said that he was quite successful. He earned a lot of money, but because he was responsible for earning money to support his family and wanted to give his family a good life, he placed enormous pressure on himself. As a leader in an organization, his work was already extremely stressful and exhausting. Yet after work hours, he continued to take on additional jobs outside. Even on Saturdays and Sundays, and even during holidays and festivals, he kept working. He worked continuously like that. Then, during a year-end gathering, while he was sitting and drinking alcohol with friends, he raised his wine glass with his right hand. Suddenly, the glass fell from his hand onto the table and shattered. He felt dizzy. His vision darkened, his face went black, and he nearly collapsed. At first, his friends thought he was simply drunk, but shortly after, they realized that something was not right. They took him to the hospital for imaging tests. After the scans, doctors discovered that his left carotid artery, the artery that carries blood from the heart to the brain, was blocked by 85%. An 85% blockage in a 42-year-old man is considered a very severe injury. At that time, although he was fully conscious, doctors decided that since it was an emergency situation, they would monitor him closely and consider surgery later. However, the cause of the carotid artery blockage was still unknown at that point. 1 week later, a follow-up scan was performed. Miraculously and fortunately, the carotid artery had reopened completely and was no longer blocked. Therefore, he did not need any medical intervention. His case was extremely lucky, but it is also a typical example of someone who worked under excessive pressure, resulting in dangerous carotid artery damage that nearly cost him his life. If he had not survived or had not received timely emergency care, the price would have been his life. That is a story I personally encountered at the end of last year. At the beginning of this year, even when I invited him out to eat, he was afraid to go. He avoided all social gatherings. I know that among our circle of friends, no one can persuade him to go out anymore. His job used to require frequent socializing, but now he no longer dares to do so. He has also reduced his workload significantly. That is one story involving someone very close to me. There is another story involving another very close friend of mine. Some of you who follow me may know that during my student years, I sold coal briquettes. I made coal briquettes, sold them, and lived in the house of an uncle. I lived together with a very close friend at that time. This friend of mine had a strong determination to build a truly good life starting from those coal briquettes. Therefore, he worked day and night. He worked with such intensity that I felt it was impossible to keep up with him. He worked up to 20 hours a day to earn money. He barely ate and saved everything. Later, even after I stopped selling coal briquettes, we stayed in contact and remained close. I knew that he had stopped selling coal briquettes and had become a government employee. But even as a civil servant, he increased his work intensity tremendously to earn money. He saved excessively, did not dare to spend, did not dare to enjoy life. Then one day, his wife woke up in the morning and realized that she had spent the entire night holding her husband who had already passed away. No one knew why he died. He was only 32 years old, an extremely young age, a very beautiful age of life. So, through the two stories I have just shared today, we come to the topic of sudden death among young people. The message that I want to convey to all of you who are watching today's program is this: health is an extremely precious form of capital. No matter how much money we may have, we can never buy health. And once you lose your health, all material possessions become meaningless. Even if you struggle your whole life to gain power and authority, without health, that power has no strength. Without health, your intelligence cannot be fully expressed or utilized in your life. That is why we want to remind you that after watching today's program, we must avoid falling into a vicious cycle where work pressure overwhelms us, where we do not have time to go for health checkups, where we overwork excessively, and where hidden illnesses gradually develop inside our bodies. Eventually, we may have to pay the price with sudden death, a phenomenon that the media has mentioned repeatedly in recent times. Ladies and gentlemen, why does sudden death, especially sudden death among young people, attract so much public attention? The reason is that it takes lives very quickly, without giving people the opportunity to react properly or allowing enough time for rescue. Because of that, it is far more dangerous than common illnesses and deserves much greater attention. We focus on two main causes in this issue. The first is stroke, and the second is sudden cardiac death. Here, I would like to present a figure from a study conducted in Australia. This study analyzed 427 cases of sudden death among young people aged from 5 to 35 years old. I repeat, from 5 to 35 years old. This study was conducted in Sydney, Australia. The researchers found that 56% of sudden deaths were caused by cardiovascular diseases and underlying heart conditions. I repeat, 56% of sudden deaths were due to cardiovascular diseases. What are these cardiovascular diseases? First and foremost is myocardial infarction or heart attack. Heart attacks are no longer diseases that occur only in elderly people. Today, heart attacks occur very frequently in young people as well. Therefore, myocardial infarction has become the leading cause of sudden death. Other cardiovascular causes include diseases of the heart muscle, such as myocarditis and dilated cardiomyopathy, as well as other conditions like congenital heart defects that people may not even be aware of. These conditions can also lead to sudden death. In summary, cardiovascular causes account for 56% of sudden deaths in young people, according to this study. The second major group involves brain-related injuries, accounting for 32% of sudden deaths. These include common conditions, such as arterial blockage in the brain, which we call cerebral infarction. When blood vessels in the brain become blocked, and brain tissue is deprived of oxygen and nutrients, death may occur. Another cause is rupture of blood vessels in the brain. This rupture may result from ruptured aneurysms from hypertension-induced vessel rupture or from inflammatory damage to cerebral blood vessels, which can cause vessel necrosis, perforation, bleeding, and ultimately death. In addition to cerebral vessels, another very common location is the carotid artery. Just like the case of my friend that I mentioned earlier, the carotid artery may suffer tears or ruptures. Both terms can be used. When the carotid artery ruptures, blood leaks out and causes dissection of the arterial wall, which leads to carotid artery blockage and may cause death. Another increasingly common problem among young people is carotid atherosclerosis. Carotid artery damage in young individuals is becoming more frequent. Therefore, brain-related sudden deaths often involve vascular injuries. In addition, there are other conditions such as epilepsy, which may be latent or long-standing. Under triggering conditions, such as overwork and stress, epilepsy may lead to sudden death without prior warning. Thus, brain-related causes account for 32% of sudden deaths. The remaining 12% involve other types of injuries. Common examples include pulmonary embolism and asthma. Asthma is becoming increasingly common in modern society due to chemical exposure and medication overuse. As a physician, I follow a principle that I never prescribe excessive medication. Medical education worldwide emphasizes that no more than 3 medications should be prescribed at once, even supplements. However, today, medication abuse is widespread. In addition, people excessively consume herbal remedies and traditional medicines, often believing they are beneficial. Many substances are soaked in medicinal alcohol and consumed without proper knowledge. What people think is nourishing may actually cause severe allergic reactions, leading to asthma attacks. Unfortunately, I see many young patients every day suffering from bronchial asthma, and asthma itself can be a cause of sudden death. Pulmonary embolism is another direct cause. These figures from the Australian study are consistent with findings from other reputable studies worldwide. This is a serious warning for our fast-paced society. These direct injuries can lead to sudden death. Now, let us talk about indirect causes of sudden death. There are many, but the leading one is still excessive pressure from modern life, which leads to overwork. Other indirect causes include alcohol abuse, overeating, and changes in dietary patterns. Many of us come from generations that experienced food scarcity. Now that food is abundant, we consume excessive calories, leading to overnutrition but micronutrient deficiency. As a result, obesity, high blood lipids, diabetes, and hypertension are extremely common. These conditions significantly increase the risk of sudden death. Another indirect cause is excessive exercise. We sometimes see football players collapse on the field due to sudden cardiac arrest. Exercise is good, but lack of proper knowledge can be dangerous. Marathon running, for example, has become very popular. Running is beneficial, but not everyone is suitable for marathon running. The originator of the marathon itself died after running 42 kilometers. For those unsuited to such endurance exercise, the consequences may include joint damage or worse, sudden death. Therefore, exercise must be done correctly, not blindly. There are also many indirect causes that may sound unbelievable. For example, carotid artery rupture can occur due to physical assault. A slap or punch to the neck area can cause fatal carotid artery injury. Severe straining during constipation can also cause carotid or cerebral vessel rupture. Excessive coughing, sneezing, laughter, or even excessive sexual activity can trigger sudden death. In men, this may be referred to as sudden collapse during intercourse, often caused by heart or brain vascular events. Women may also experience sudden death during intense intercourse, sometimes due to air embolism, where air enters the bloodstream and causes pulmonary embolism. In summary, sudden death almost always involves an underlying disease: cardiovascular disease, cerebrovascular disease, asthma, or other chronic illnesses combined with triggering factors such as overwork, excessive strain, overeating, alcohol intoxication, or emotional stress. I am personally very concerned about children. Earlier, I mentioned the case where a slap to the face, if it accidentally strikes the area of the carotid artery, can lead to death due to rupture or tearing of the carotid artery. This is a real story, ladies and gentlemen. There have been parents who, in a moment of anger, slapped their child on the cheek as a form of discipline. Unfortunately, if the slap lands precisely over the carotid artery, it can cause fatal injury and result in the child's death. I emphasize this so that parents can control their anger and avoid tragic, heartbreaking incidents like this. I would also like to share something further. In fact, I was among the first to write warnings about what is known as shaken baby syndrome, particularly in children under the age of 4. This syndrome can cause sudden death or severe brain injury. What does shaking a child mean? First and foremost, slapping a child is included in shaken baby syndrome. This is because a child's brain is not fully developed. In young children, especially those under 4 years old, the brain contains a large amount of fluid. There is space between the brain tissue and the skull, filled with fluid, and surrounded by many fragile blood vessels. When a child is slapped, in addition to potential injury to the carotid artery, there is a very high risk of tearing cerebral blood vessels, leading to brain hemorrhage and death. Another extremely dangerous behavior is when parents, especially fathers, throw their children up into the air and catch them. This is also considered shaking. Tossing a child up and catching them, or playfully shaking a child, is extremely dangerous. I once lived in an apartment building where a child nearly fell from a height. The father rushed to grab the child suddenly. This action, although instinctive, was extremely dangerous. If a child is already in the process of falling, it is sometimes safer to allow the fall rather than stopping the child abruptly. A sudden stop can cause severe tearing of cerebral blood vessels, leading to death. This is precisely the mechanism of shaken baby syndrome. Many parents believe these actions are harmless play or acts of protection, but they can be the cause of tragic accidents. Now, returning to our main topic, let us analyze stroke in more depth. Recently, media and social networks have reported many cases of young people suffering strokes, with an increasing number of deaths worldwide. Naturally, many people wonder whether this is related to COVID infection or COVID vaccination. As of now, I must state clearly that there is no conclusive global evidence proving that COVID or COVID vaccination directly increases stroke incidence among young people. We do know that COVID can affect blood clotting mechanisms, but this is not unique to COVID. Many viruses and bacteria can also influence coagulation pathways. Therefore, at this point, we must wait for more comprehensive statistical data before drawing conclusions. Personally, I believe this phenomenon is part of a broader societal context rather than being solely attributable to COVID. Now, let us revisit the vascular causes of stroke, particularly involving arteries from the carotid upward. First are brain vascular malformations, such as arteriovenous malformations, where arteries and veins connect abnormally. These conditions may exist silently without symptoms until rupture occurs. Cerebral aneurysms are also increasingly common among young people. Chronic stress and modern dietary habits, including excessive intake of fats, triglycerides, and cholesterol, contribute to vascular wall weakness and aneurysm formation. I want to issue a serious warning here. Nowadays, during ultrasound examinations, I see children with fatty liver disease almost daily. 10 years ago, this was nearly unheard of in children aged 4 or 5. But over the past 2-3 years, cases have increased dramatically. This is a warning to parents. We will dedicate future programs to topics such as dyslipidemia and fatty liver disease in children, so we can protect future generations. High blood lipids can lead to cerebral aneurysms, which may rupture, cause intracranial hemorrhage, and result in sudden death. Now, regarding sudden death in young people, one commonly discussed cause is carotid artery rupture, also known more gently as carotid artery dissection. The carotid artery has an inner lining. When we perform ultrasound examinations, we can detect damage to this inner layer. Previously, I was skeptical about performing carotid ultrasounds on young adults in their 20s, but now I strongly support it because carotid artery injuries are occurring at increasingly younger ages. Damage to the inner arterial lining can be caused by inflammation, not necessarily bacterial, which leads to ulceration. Blood can then enter the vessel wall, causing dissection and narrowing of the artery. Another cause is sudden excessive exertion, such as forceful movements or intense labor. Direct trauma, such as slaps or punches to the neck, can also cause carotid artery injury. Additionally, intense coughing, sneezing, severe straining during constipation, or sudden increases in intrathoracic pressure can rupture the carotid artery. Blood may accumulate within the vessel wall or leak outward, causing narrowing and potentially leading to death. The second major carotid artery issue that we must pay close attention to is early onset atherosclerosis in young people. This is becoming increasingly common due to modern diets high in cholesterol and fats. The third group of causes involves vascular inflammation, either due to infections or autoimmune conditions, which damage blood vessels throughout the body, from the carotid arteries to cerebral vessels and beyond. The fourth group includes congenital abnormalities of blood vessel walls, such as conditions causing stiffening and weakening of arterial muscle layers. These lead to alternating segments of narrowing and dilation, increasing rupture risk. These cases are rarer and often related to genetic predisposition. The final group involves blood coagulation disorders, including hypercoagulable states or bleeding disorders. Hypercoagulability can be caused by many factors, even dehydration. Inadequate water intake can increase blood viscosity, leading to clot formation and sudden death. In summary, vascular injury is the primary cause of stroke-related sudden death in young people. These vascular injuries can occur anywhere in the body, not just in the carotid arteries. If they occur in coronary arteries, they cause myocardial infarction. In lower limb arteries, they cause ischemia and gangrene, sometimes requiring amputation. I frequently see young patients with lower limb arterial damage. Injuries to the abdominal aorta, renal arteries, or pulmonary vessels can also cause catastrophic bleeding or embolism, resulting in sudden death. Thus, while we often focus on cerebral vessels, cardiovascular causes actually account for a larger proportion of sudden deaths. Ladies and gentlemen, from the beginning of the program until now, we have gone very deep into the analysis, haven't we? In essence, the vast majority of injuries that lead to sudden death are vascular injuries. These injuries may occur in the brain, in the heart, or in other organs of the body. For example, pulmonary embolism is a vascular injury. Blood clots originating in the veins of the lower limbs can travel upward to the lungs, the heart, or even the brain, causing sudden death. Today, I encounter young patients almost continuously who suffer from vascular injuries in the lower limbs. In some cases, the damage is so severe that amputation is required. Injuries to the abdominal aorta can also be catastrophic. When an aortic aneurysm ruptures or an aortic dissection occurs, massive bleeding follows, and the patient may pay with their life in a very short time. Renal artery injuries, pulmonary artery injuries, anywhere in the body where there are blood vessels, such damage can occur. Every blood vessel carries the potential for fatal injury. However, although we often talk a great deal about cerebral vessels, the number of sudden deaths due to cardiovascular causes is actually higher than those caused by brain vascular injuries. Now, let me help you visualize something. The human body contains approximately 96 kilometers of blood vessels. If we were to stretch all the blood vessels in your body and connect them end to end, they would extend for about 96 kilometers. That is an astonishing number. Think about it. This vast vascular network is an incredibly complex and sophisticated system. Take the brain, for example. The blood supply to the brain resembles a massive and highly intricate infrastructure project. There are two main sources supplying blood to the brain. The first is the primary route, which is the carotid arteries located in the front of the neck. The second is the secondary route, which consists of the vertebral arteries located at the back. The carotid arteries are the main highways carrying blood from the heart to the brain. They supply blood to the entire anterior brain, the entire middle brain, and approximately 3/5 of the posterior brain. In other words, the carotid arteries are the principal suppliers of blood to the brain. If the carotid arteries were to become completely blocked, death would be almost inevitable. Why? Because the anterior brain, the middle brain, and 3/5 of the posterior brain would be deprived of blood, and the secondary routes cannot compensate fully for the loss of the primary routes. On the other hand, if the vertebral arteries are blocked, there is still some chance of survival because the primary carotid system may partially compensate. The vertebral arteries supply the brainstem, the cerebellum, and about 2/5 of the posterior brain, which contain vital centers for breathing, heart rate, and consciousness. Damage here is extremely dangerous, but compensation is sometimes possible. This example illustrates just how delicate and complex our vascular system is. Now imagine this: 96 kilometers of blood vessels, all functioning continuously day and night. When this system is damaged, the consequences can be devastating. I often explain the vascular system using a very simple analogy. Blood vessels are like the water pipes in your home. If every day, after cooking, you pour grease and oil down the sink, those fats gradually stick to the inner walls of the pipes. Over time, dirt and debris accumulate. Eventually, the pipe becomes clogged. Clearing it is extremely difficult, and in severe cases, the pipe may burst, releasing foul odors and causing major damage throughout the house. Our blood vessels work in exactly the same way. What is the grease in our blood vessels? It is lipids, triglycerides, cholesterol, and other fats. When blood lipid levels are too high, these substances adhere to the vessel walls. Once they stick, they attract other elements, such as platelets and inflammatory cells. Over time, this accumulation forms atherosclerotic plaques. The term plaque comes from Latin. Initially, these lipid deposits appear yellowish and soft. When examining blood vessels from deceased patients, one can see these yellow, mushy substances clinging to the vessel walls. Gradually, they harden, narrowing the vessel and reducing blood flow. This is why we must never allow our blood lipid levels to rise excessively. I like to use a metaphor here. I call them the three musketeers, or sometimes the three cannons that destroy blood vessels. High blood pressure, high blood lipids, diabetes. These three conditions work together to cause atherosclerosis and vascular stiffening, and they are among the primary causes of sudden death in young people. Although today's program emphasizes young people as a warning, the truth is that elderly individuals are affected even more severely. This program is equally meaningful for older audiences, but we emphasize young people because we want early awareness and early prevention. We must begin prevention from childhood. If these conditions already exist, we must actively correct them. Ultimately, when we summarize all causes, we find that the vast majority of sudden deaths originate from vascular damage, just like clogged water pipes. If we do not maintain our pipes properly, blockages are inevitable, and the consequences can be disastrous. According to global statistics, over 2 million people die suddenly each year due to overwork. A study covering the period from 2000 to 2016 found that an average of 745,000 people per year died suddenly due to working more than 55 hours per week. Men account for approximately 3/4 of these deaths. The highest rates occur in Southeast Asia and the Western Pacific, including Japan, China, and Australia. Working more than 55 hours per week is now recognized as dangerous. About 9% of the global population currently works excessive hours, a 29% increase compared to the year 2000, and this number continues to rise. Modern life pushes us into chasing external values, status, money, positions of authority, instead of listening to our inner selves. We work relentlessly, sacrificing meals, family time, and rest. We eat fast food for convenience. We rush through life at dangerous speed. Speed itself is dangerous. Walking rarely causes fatal accidents. Cycling is more dangerous. Motorbikes are more dangerous still. Cars can be deadly. The faster we move, the greater the risk. Our lives have become too fast, too rushed, and too pressured. This pressure leads to long working hours, insufficient sleep, chronic stress, and ultimately illness. We develop hypertension, diabetes, high cholesterol, vascular damage, stroke, and sudden death. These outcomes are not accidental, they are the price we pay. Ladies and gentlemen, I believe that up to this point, we have all seen very clearly that sudden death among young people is not something accidental. It is the consequence of a long process, and one of the most important driving forces behind this process is overwork. According to data and warnings from the World Health Organization, sudden death related to overwork has been recognized as a global health issue for many years now. Who has lowered the dangerous threshold from 60 working hours per week to 55 hours per week, emphasizing that working beyond this limit significantly increases the risk of sudden death. On a global scale, statistics show that every year, more than 2 million people die suddenly due to excessive work. A large-scale study covering the period from 2000 to 2016 revealed that an average of over 745,000 people per year die as a result of working more than 55 hours per week. Among these cases, men account for approximately 3/4 of the total. The regions most affected are Southeast Asia and the Western Pacific, including countries such as Japan, China, and Australia. The warning threshold of 55 hours per week is not arbitrary. It reflects a level of work intensity that the human body is not designed to sustain over long periods. It is estimated that about 9% of the world's population currently works at this dangerous level, representing an increase of 29% compared to the year 2000. And this number is still rising. When we talk about death due to overwork, we cannot avoid mentioning Japan. Japan is the country where sudden death among young people due to excessive work has been most clearly recognized and documented. In fact, the Japanese term karoshi literally means death from overwork. The first medically documented case of death due to overwork was reported in 1969, involving a 29-year-old man in Japan. He worked for the distribution department of a well-known newspaper company and died suddenly after prolonged periods of excessive work. During the economic bubble of the 1980s, many Japanese executives died in similar ways. These deaths shocked society and forced the public and authorities to pay serious attention to the issue. In 1987, Japan's Ministry of Health, Labor and Welfare began systematically collecting and analyzing data related to sudden death and overwork. The findings were alarming. Approximately 1/4 of male workers in Japan were working more than 60 hours per week. And remember, even 55 hours per week is already considered extremely dangerous. This level of work is considered non-physiological labor, a state in which normal human life and bodily functions are gradually destroyed. Prolonged fatigue accumulates over time, eventually leading to death. Many scholars believe that if a person works more than 60 hours per week, or works more than 50 hours of overtime per month, or works more than half of their annual rest days, they should be classified as being severely overworked. At this point, I would like everyone watching to pause for a moment and ask themselves, am I overworked? Another factor emphasized by researchers is sleep deprivation. Continuous work for more than 24 hours without rest, without adequate sleep, significantly increases the risk of sudden death. When we talk about this, many people immediately think of professions such as police officers or healthcare workers who must work night shifts. But in reality, many other professions also suffer from chronic sleep deprivation. When we talk about overwork, the sad truth is that most people are very indifferent to the question of how to protect themselves. That is something I strongly believe should change. Now let us look at the biological mechanism behind sudden death caused by overwork. The mechanism is actually quite simple and not mysterious at all. There are two major systems involved. The first is the adrenal gland system. The second is the sympathetic nervous system. These two systems are extremely important. The adrenal glands secrete two key hormones, adrenaline and noradrenaline. These hormones are released when we are under stress, fear, or sudden threat. For example, if you suddenly feel threatened or attacked, your adrenal glands immediately release adrenaline and noradrenaline. These hormones prepare your body for fight or flight. However, when we are constantly overworked, constantly stressed, and constantly under pressure, the adrenal glands continuously release these hormones at high levels. These hormones act as messengers, transmitting stress signals throughout the entire body. One of their most significant effects is on blood vessels. They cause blood vessels to constrict, leading to increased blood pressure. If this state continues over time, temporary blood pressure elevation becomes chronic hypertension, which is extremely dangerous. You may have noticed that when you are angry or stressed, your face turns red and your heart races. That is the effect of adrenaline and noradrenaline. At the same time, the sympathetic nervous system becomes overactive. This system regulates states of alertness, anxiety, fear, and emotional tension. When it remains activated for long periods, the body enters a state of chronic stress. This chronic stress leads to a cascade of health problems. Among them, vascular damage is the most critical. High blood pressure damages blood vessels. It disrupts lipid metabolism, leading to increased blood lipids and cholesterol. This promotes atherosclerosis. High blood sugar follows, and diabetes develops. Diabetes, in turn, further damages blood vessels. This creates a vicious cycle. Thus, prolonged overwork causes sustained hormone secretion that affects every organ system in the body. I often use myself as an example. I am in my 50s, yet compared to many of my peers, I still appear relatively young. When I return to my hometown, people often ask how old I am, surprised by my appearance. It is not because I do not work hard, I work a great deal. But I know how to regulate my workload and avoid falling into a state of chronic overwork. When you manage stress properly, your body ages more slowly and your organs remain healthier. Now we return to the third part of today's program, a section that I believe many of you have been waiting for, the signs that indicate overwork and how to recognize them. I am going to share with you 10 warning signs. Please pay close attention and see whether you recognize yourself among these signs. The first sign is abdominal obesity, a protruding belly. The second sign is hair loss, especially patchy hair loss or excessive hair falling out during combing or washing. The third sign is declining memory, becoming forgetful even about small, everyday matters. The fourth sign is frequent urination. The fifth sign is increasing difficulty concentrating. The sixth sign is reduced sexual desire and decreased sexual performance. The seventh sign is declining physical strength and endurance. The eighth sign is sleep disturbance, difficulty falling asleep, excessive dreaming, waking up feeling exhausted and weak, and poor sleep quality. The ninth sign is frequent headaches, chest tightness, ringing in the ears, or palpitations. And the 10th sign is emotional instability, becoming easily irritable, negative, pessimistic, and having difficulty controlling one's emotions. Ladies and gentlemen, please take a moment to reflect. How many of these 10 signs do you recognize in yourself? For those who work more than 60 hours per week, or perform more than 50 hours of overtime per month, or work more than half of their annual rest days, I strongly recommend that you evaluate yourself carefully using these 10 signs. Here is how to interpret the results. If you have 3 signs or fewer, congratulations, you are still within an acceptable range. If you have between 3 and 6 signs, it indicates that you are already working somewhat excessively. But if you have 6 or more signs, I am sorry to say that you are already in the danger zone, the so-called red zone. To be honest, even I myself recognize that I fall into the category of overwork. With the exception of the first sign, abdominal obesity, I understand that many of the other signs apply to me due to chronic stress. Among these 10 signs, abdominal obesity deserves special attention because it has become extremely common in modern society. A protruding belly is not just a cosmetic issue, it reflects serious metabolic problems. We should not simply say a big belly without understanding what qualifies as abnormal. The assessment is actually very simple. Take a measuring tape. Measure the largest circumference of your waist. Then measure the largest circumference of your hips. Divide waist circumference by hip circumference. For women, a ratio below 0.85 is considered acceptable. A ratio of 0.85 or higher indicates abdominal obesity. For men, a ratio below 0.9 is acceptable. A ratio above 0.9 indicates a problem. The larger the abdomen, the greater the danger. Abdominal obesity is associated with many severe health consequences. I want to emphasize that maintaining a healthy waistline must begin in youth. Once a person passes the age of 30 and develops persistent abdominal obesity, it becomes extremely difficult to reverse. The metabolic damage is already deeply entrenched. In the past, people believed that a protruding belly symbolized prosperity and benevolence. In modern medicine, however, abdominal obesity is recognized as a serious health risk. This measurement is simple. I encourage parents to monitor their children and never allow abdominal obesity to develop. Proper diet and regular physical activity are essential. We will dedicate many future programs to these topics. Now, due to time constraints, I will summarize briefly. I would like to share 7 practical strategies that can be applied by anyone who finds themselves in a state of overwork. First, after every 20 minutes of work, stand up and move around for at least 1 minute. Even during meetings, try to stand or move briefly after about 20 minutes. Second, drink water regularly. Maintain a habit of drinking at least 2 liters of water per day, equivalent to about 8 small cups. Ideally, drink water every hour to help reduce uric acid levels and improve circulation. Third, exercise regularly. Any sport you enjoy can be beneficial, as long as it suits your physical condition. Fourth, for office workers, invest in proper equipment, a suitable desk, chair, and monitor that support good posture and comfort during work. Fifth, go to bed early and wake up early. I know this is difficult for many people, but please make an effort. Sixth, apply what I call the office fishing technique. Seventh, take occasional vacations to relax and recharge. Many of you already understand the first 5 or 6 points. However, the concept of the office fishing technique may be unfamiliar. This is a psychological strategy that helps people escape the trap of chronic overwork. Think about fishing as a recreational activity. When you fish, you disconnect from everything else. You go to a quiet place, focus on the fishing rod, and temporarily forget all other worries. In the workplace, we should occasionally adopt a similar mindset. Sometimes, it is necessary to appear a bit indifferent, to let go of excessive responsibility, and allow others to share the burden. If today's work is not completed, accept that it can be continued tomorrow. By doing this, we release pressure instead of constantly imposing it on ourselves. Personally, this is how I manage my workload. I keep things simple. I focus on my work, but I also know how to transform work into a source of enjoyment rather than stress. When I treat patients, I combine medical evaluation with friendly conversation. This not only helps me understand the patient better, but also reduces my own stress. For those working with clients, engaging in meaningful conversation can also be a form of stress relief. What appears to be professional interaction is, in fact, a way to decompress mentally. I handle an enormous workload: clinical work, hospital duties, and producing educational programs like this one. But I diversify my work so that one task becomes a source of relief from another. I never put all my eggs in one basket. When work accumulates and remains unfinished, stress multiplies. That is why many organizations now implement afternoon tea breaks or happy time sessions, allowing employees to relax briefly and restore energy. Before we conclude today's discussion, I want to emphasize one final message that has been consistent throughout the program. Health is the most valuable asset in our lives. It must be protected early and continuously. Once lost, it is extremely difficult to regain. Thank you for watching. I will return with many more important and useful health topics. If you found this program helpful, please like, share, and subscribe to Doctor's Wisdom Share so you and your family can stay updated with valuable health information. And I look forward to seeing you again in our next episode.